I genuinely love newborn care. I practiced in Chicago for 17 years prior to my move out here to San Diego, and we had a pretty young practice because a lot of our families would stay in the city but then have a few kids and move to the suburbs. So we had a relatively young practice in my Chicago area location. And I just got very comfortable and familiar with newborn care. So that is a fondness of mine. But I also have 2 kids of my own, one who is 16. So I also feel like I also can get the teenage issues as well. So yeah, really all ages. But I definitely feel like the newborn, the infant through toddler stage is a favorite of mine. I think families with children need a pediatrician. I think pediatricians are given extra training in the care for kids 0 to 18. And so I just feel like they're an invaluable resource for all families with kids due to that special training for kid care. The piece of advice I would give to parents is to know that every baby is different. They're not all cut from the same cloth. So something that you read in a book that might work for some parents and their infant maybe isn't going to work for you and your infant, and that's okay. So all babies are different, and the approach that we use for each baby is going to be different, but that's okay, and there's no one book that's going to be the right answer for all the questions, and that's what I try to help with in terms of feeding and sleep and behavior and all of those things, telling parents this is still normal. It might not have been in the chapter you read last night, but this is still okay. I think a benefit of choosing me to be their child's pediatrician is that I'm a very open person. I'm easy to talk to. I'm a good listener. I care a lot about every single patient that I see, so I would be a good partner in helping with the raising of a child. I think the most important part of the doctor-patient relationship is trust. I feel like I am a good listener. I feel like when families come in with concerns, I always listen to what they have to say and take all concerns very seriously. I feel like people feel comfortable talking to me and letting me know what's going on with their child. I'm great at following up too. So if it's something that comes up that is unclear what to do at the moment, okay, let me do some research, get back to you. So, but I do think trust is a very essential part of the relationship. The most satisfying part of my job is knowing when I've seen the patients for the day that I've done the best that I can, that all of my patients have been well cared for, all of the parents' questions answered, everybody, if they need to see a specialist, is on their way to do so. Otherwise, if reassurance is all that's needed, then that is what is given. So a satisfying part is knowing I've done the best I can to help a family navigate their path with their child.